You are welcome again to
Yes.
antenatal class of Mother and Child Hospital. This morning, our topic is on prematurity or preterm birth. Prematurity or preterm birth. Like I said, during this class, after the teaching, you can ask questions from any issue that you have. Because I'm sure that some of us that are in their first trimester, second trimester, and third trimester, you can ask any question if you have issue when you are at this stage. But this morning, the topic we are going to look or consider is preterm birth. Preterm birth. Preterm birth is a birth that occurs before 37 weeks of pregnancy. From 27 weeks to 37th week of pregnancy. 36 weeks, 37 weeks, they are referred to as moderate late preterm. You know, they are late, but, you know, because full term is 40 weeks. 40 weeks, and it can be late. You know, you can have up to 41 weeks, which is when you say the woman is post-term, you know. But preterm birth occurs from 27 weeks to 37th week. And between this period, we also categorize them into three. We have the extremely preterm, that is from 27 weeks to 28 weeks. 27 to 28 weeks, they are extremely preterm. When you have a baby within this period, they are extremely preterm. They are usually very small. Then you have the next one, very preterm. Very preterm are those babies born from 28 weeks to 32 weeks. Very preterm. They are a little older, but they are still small. And then we have the moderate preterm. Those ones, we may not worry too much about them, but they are still regarded as preterm. Preterm babies, they are usually very small, and as much as possible, we try to help the mothers to avoid giving birth to them within that period. As much as possible, if you are beginning to have signs like lower abdominal pain, like you're having back pain, and you are still within your second trimester, then your doctor might say, come on bed rest. The aim is to avoid or prevent you from going into preterm labor and having preterm baby. So we want to look at why do preterm birth happen? Why do some women go into preterm labor and have preterm babies? Sometimes we really cannot tell you why. We really cannot say this is the reason. Because I've asked the doctor before, and you know, he said, even my wife, the 3 children we have, they were preterm, and we really cannot tell why. Sometimes there can be medical conditions. Maybe the woman has blood pressure. If there is blood pressure, sometimes some women can go into preterm labor if, you know, it is not controlled. Or if there is diabetes. Then if a woman has multiple pregnancy, maybe you have twin pregnancy, or you have triplets pregnancy, or quadruplets, the uterus will be over distended, and that can spark up premature contraction that can lead to premature delivery. Then cervical issue. There are some women who have issue with their cervix. As the pregnancy progresses, so maybe mid-trimester or early third trimester, the cervix may begin to give way, may begin to open. For those who have cervical issue, it can be helped by putting what we call cervical sacrilege. Your doctor, if you give history of having your cervix opening before your term, your doctor might say, okay, let's put cervical sacrilege in the first trimester, usually. And it will help to be able to, the woman to carry the baby to term. But if for one reason it is missed, or the woman forgets to tell the doctor about this history, then the pregnancy will progress, and maybe in the mid-trimester or early trimester, she might go into labor and have a preterm birth. Now, having discussed what can lead to preterm birth, sometimes some women, when they have cervical sacrilege, their doctor may say, please, no conjugal rights for now. I'm sure we understand what I mean by conjugal rights. Hello? Mothers?
Yes.
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 Your doctor can say, avoid conjugal rights, and maybe until you are right in the late third trimester, you can say then you can begin to do anything. All is to avoid preterm delivery. Now, when a woman have preterm delivery, that is the topic we are really going into. How do we handle this birth? How do we take care of this baby? When a baby is born before term, usually, sometimes they are less than 1 kg. Sometimes they can be 1.5. Some can even be 2 kg and they are still preterm. They can even be 35 weeks. 35, you can get some 35 weeks baby that will be up to 2 kg. When they are up to 2 kg, then we just observe them in the neonatal intensive care unit. That is where we take care of preterm babies. That's where we take care of preterm babies, in neonatal intensive care unit. If you happen to deliver your baby at 35 weeks, 34 weeks, your baby surely might go to intensive care baby unit to be observed because they are still preterm. If they have good birth weight, some other issues which might come up will be detected in the unit before the baby is discharged. Usually, they don't stay long when they are 34, 35 weeks. They don't stay long in the NICU, that is intensive care baby unit. But when the baby is 1.5, 1 kg, or less than 1 kg, then that is where they are specially cared for in the incubator. Some 34, 35 may not go into incubator, but a week 34 we go into incubator. And less than 1 kg, 1 kg, or less than 1.5 kg, we go into incubator. The incubator is a place where the preterm baby is taken care of. In the incubator supply heat for the baby, protect the baby from the outside world and give the baby an environment that mimics the womb. And the nurses who takes care of them observe sterile, they do sterile, what we call sterile procedures. Before they go touch the baby in the incubator, they will wash their hands. They wear gloves sometimes, but in most cases, we advise they wear gloves. But sometimes when they are not in the incubator, they just wash their hands, clean it, use sanitizer, and can touch the baby outside the incubator. But when the baby is in the incubator, they wear gloves to touch the baby. As much as possible, what we are trying to do is to prevent infection to the baby. When the baby is in the incubator, we also want to maintain warmth for the baby. Babies who are born prematurely, their temperature regulating center in the brain is not well developed. So when they lose heat, it's difficult to regain the heat. So as much as possible, we avoid allowing them to lose heat. So they are kept in the incubator and the temperature in the incubator is regulated. The preterm baby also will need to be able to breathe properly. Because they are preterm and they have low birth weight, even their respiratory system is not fully mature. That's why sometimes before they are born and the doctor realizes that this baby might be born before time, they are given some injections like steroid. The injection is called dexamethasone. The mother can take about 2-3 shots before the baby is born to help the baby's lung to mature, to also help the baby's lung to function well when the baby is born. So when the baby is in the incubator, sometimes we give them oxygen. They may not be able to take in enough oxygen that will be able to supply oxygen to all other parts of the body. So when the baby is in the incubator, you will see that the baby will have a rubber in his or her nostril that is supplying oxygen to the baby to support whatever the baby is able to take in. When the baby is also in the incubator, we also want the baby to gain weight. You know, once the baby is out, every nutrition that the baby needs to take from the mother is cut off. So when the baby is in the incubator, we also want to make sure that this baby is able to take nutrition. The baby also is able to have fluid. You know, the baby will be weaned, you need to replace the fluid. The baby will poo, we need to replace, you need to give food to the baby so that the baby's weight will continue to increase even while in the incubator. So when they're in the incubator, the doctor will mix some fluids together and will hang it. Some of them can have the fluid given to them through the umbilicus. And after that, if we are done with that, we'll stop it and we'll look for veins on their body and put it. This is where most mothers feel, they are not happy with. They don't like you pricking their babies, especially these premature babies. But there's nothing we can do. We have to give the baby fluid and give them other nutrients that they need. So once the umbilical cord is done with, maybe we use it for 1 week, We'll stop using it and we'll start looking for veins on the baby's body. All is to help the baby to get everything that the baby needs to survive. So we give the baby fluid and we give the baby other nutrients that the baby needs. Sometimes some of these babies, we tell the parents that they should give us breast milk. They should try. And sometimes it can be difficult because if there is no sucking, production of breast milk is low. Because when there is sucking, there is a stimulation that helps the brain to know that milk production should commence. But because the preterm baby cannot suck, so the body will just rely on the fact that the hormone in the body that is supporting pregnancy is withdrawn. The one that should begin to bring breast milk should be on. So the woman will now begin to either do artificial expression of milk or using machine to express the milk. And this will also help the milk production. So as much as possible, if you find yourself in this situation, try to help to produce milk. Your breast milk is very important for the preterm baby. Is your milk. It is sterile. Everything that your baby needs to grow is in it. All the what will prevent infection is inside it. So we encourage mothers to please produce milk and bring to the special unit where the preterm baby are cared for. And we'll begin to give it to the baby. Sometimes we start with as small as 1 meal. Can you imagine a baby starting feeding with just 1 meal? But that is what the baby can take at that time. A baby of less than 1 kg or just 1 kg, 1 meal of the breast milk will be given to the baby to start with. And then subsequently, as the baby tolerates, we'll now begin to increase it. But as much as possible, breast milk is what we really desire. And when this is produced, all other issues that can affect the baby and gastrointestinal tract can be avoided. When the baby is in the incubator, like I said, we prevent infection by washing our hands, wearing gloves, and we don't allow people to enter, only the parents. We allow the parents to come in. They will see their baby. Initially, you may not be able to touch, but you can see your baby. You can see your baby grow. You can see your baby move. You also see some other gadgets that will be attached to your baby's body. Everything is to help the baby to be able to grow and survive this period. You see all the gadgets that will be attached to your baby's body that you will see. They include things that will help to monitor the heartbeat of the baby, the respiration of the baby, the temperature of the baby. You will see all of them. Because when all these are monitored, we'll be able to see whether the heart is good, the heart is functioning well, or we need to do something. We also see whether the respiration is good, or is fast, or is slow. All this helps us to know how the baby is performing. Then we also want to check whether the baby is pooing. You may say baby is not eating anything fluid. Yes, baby will still poo. We'll check it. Baby will still wee-wee because the baby will be on fluid to help the body to function well. And then sometimes we also ask eye doctor to come and see your baby in the incubator. This is very, very important. may be expensive, but it's very good because preterm baby have issues with eyes. So in order to avoid it or to nip it in the bud or to get it, as quickly as possible, we ask the ophthalmology to come and evaluate the preterm baby's eye. If there is anything to be done, then it will be done as soon as possible. While your baby is in the incubator, you'll see sometimes the blood samples will be taken from the baby. We want to know the blood level. One of the problems that preterm babies can have is low blood level. And anyone who have been in that situation will see that the child will be transfused. So when your doctor says the baby's blood level is low and we need to transfuse, it's part of the it's part of the management that we give to preterm babies. And then some preterm babies also, they can have jaundice. When they have jaundice, we use what we call phototherapy. Phototherapy, the light, there's a purple light that will shine on the baby. This purple light will help the baby to be able to excrete all the excess destroyed blood that is giving jaundice in the body. So the baby will not have issue, with excreting the excess blood that is being destroyed from the body. Sometimes as we feed this baby, sometimes you can be asked to buy some supplements that will help the baby to grow quickly. So those supplements, sometimes we don't have it in Nigeria. Those who have who can get in touch with their relations abroad, they can get it and we'll add this to their feed. It's called Expander. It will help the baby to add weight quickly, and then the baby can leave the incubator. While the baby is growing, maybe from less than 1 kg to 1 kg to 1.2, 1.3, 1.5, then at this point, we'll begin to ask the mother to begin to have a feel of her baby. That is what we call Kangaroos Nursing. At this time, maybe from 1.5 kg, we'll ask the mother to come in. She will wash her hand, and then she will carry her baby, and we'll use a cloth to wrap the baby with her on her chest. The baby will be lying on her chest in between her breasts, so that the baby can have a feel of the mother and the mother can have a feel of the baby. It's called bonding, the preterm bonding with the mother. She will do this for a while, and then we also begin to introduce her to how to clean the baby, because while the baby is in the incubator, we also clean them, not with water, but with oil. We clean them with this until we are able to give them a proper bath with water and soap. But at this stage, before they are 2 kg, we'll just clean them with oil. And it does not mean that the baby will have body odor. It does not mean the baby will have body odor. So all this the mother will be exposed to, so that by the time the baby is going to be discharged home for the mother to care for, she will not have problem, she will not have issue. And when the baby is discharged at 1.5 kg or about 2 kg, she will be given short appointments where she will come and see the doctor, and we will evaluate how the baby is doing. until finally the baby will be discharged, and then they will begin to have the proper appointments that they are supposed to have. So this is how we take care of preterm babies once they are born. They also have chance to survive if proper care is taken. So we encourage mothers, once you begin to have lower abdominal pains, back pain, and you are not due yet, please come to the hospital immediately. If it can be helped, you'll be placed on bed rest so that we can still gain some time for the baby in the womb. But in case it cannot be helped and the baby has to be born, the baby still have chance. From 27 weeks upward, before term, anything less than, we may not be able to help. That is abortion. Anything less than that is abortion. The baby may not be able to be helped. So these are what we do for preterm babies when they are admitted in the intensive in the neonatal care units. Thank you. So I want to listen to your question. Hello, mothers. Mothers.
Yeah. Hello. Matron.
Let's
Yeah, this is
listen to your question.
Yeah, hello. Can you hear me?
Yes, I can hear you.
Okay, yeah. This is Adenike. So you mentioned something about cervical issues.
About
as one of cervical issues.
Yes, cervical
as
issues.
One of the things that may cause preterm.
Yes.
But you said for a woman who has experienced it before, she needs to let her doctor know ahead so that they can insert something. I don't know what you called it, okay?
It's called cervical sacrilege.
Sacrilege. So for a woman who is experiencing a first-time pregnancy and probably doesn't know this, how we should know about, if she has cervical issues that could cause, preterm birth?
Okay. If such woman attends her antenatal clinic regularly, she will definitely make some complaint about some discomfort in the lower abdomen. And that will prompt the doctor to want to do a scan, because if you do a scan, you will definitely get matters arising at the cervix.
Okay.
So if the doctor checks with scan and sees that the cervix is beginning to yield under the weight of the uterus, of the weight of the baby, then the woman will be counseled to put a cervical sacrilege in the first trimester.
Okay. Thank you.
You're welcome. Let's have our questions coming in. Let's have our questions coming in, mothers.
Hello, good morning.
Good morning. Good morning, Lakami. Sheung.
Yes, ma. Please, you talked about the expander.
Yeah.
For the supplements for the babies born premature. Yeah. Can we get them in Nigeria?
Yes, the problem with that expander is not all the babies. We don't use it for all the babies, but there are some of them that they use it for. But usually, when the doctor writes the name for them, they either contact their relations abroad. If they can get it, they will buy it.
So there's no way to get them in Nigeria.
Yes, we have not seen it. We have not seen it in Nigeria. For now, we have not seen. All those who have used it, they got it sent to them from abroad.
Okay.
Yes.
Thank you.
It's
And
not
you said
something that you say you
before
buy and keep.
27
It's not
weeks.
something like that.
Oh, you said before 27 weeks, the baby cannot be salvaged.
You
But
know,
we used to hear viability is from 24 weeks.
yes, from 27 weeks. From 27 weeks,
Okay.
not all hospitals can handle it. There are some hospitals that can handle it. Even at 27 weeks, your doctor, the pediatrician will say, this is 50-50. Even at 27 weeks, they will say 50-50. If the baby is very small, then the chances is 50-50. You understand? Because 26, 27 is still close. But from late 20, because some people will just be 26 weeks plus and the baby will come out. Do you understand?
Yeah.
Mm-hmm.
Yeah.
So, and they are very small, like 800 grams.
Okay.
It's very small, yes.
Okay. But once it's above 1 kg or close to 1
once it's above 1 kg, yes, above 1 kg, some hospitals can manage it. Mother and child can manage over 1 kg.
And the steroid shot too, the steroid shot for the lungs. When can it be administered? You
see, when the woman reports in the hospital and complains of premature labor, and it's around 27, 28, 29 weeks, the doctor will order for that injection to be given. She will have the injection daily, maybe for 3 days, and then before the baby is born. It is to help the lungs of the baby in the womb to mature, so that when the baby is eventually born premature, the baby will be able to cope better than somebody who did not have it.
Okay. Thank you very much, ma.
You're welcome.
Okay, good morning, ma.
Good morning.
Okay, my name is Esther. It's my first time. Thanks for information shared today.
Yes.
Okay, I just wanted to ask a question. You were saying something about signs of knowing how maybe you want to have a preterm baby or so. And you kept talking about backache and lower abdominal pain, right?
Yes.
Okay, I've been doing some readings, and from the readings, I know that you could have abdominal pains or backaches, and it might not be linked with preterm. So I'm like, is there a particular way the pain would come that you would know that, oh, okay?
You see, sometimes when the uterus is growing bigger, you can begin to have some ligament pains, But by the time you explain to your doctor, some people, the kind of pain they will have, and they will tell their doctor, the doctor will know that this is not, the uterus might begin to contract with it. Do you understand? It's not just going to be just back pain and lower abdominal pain. If the doctor put the hand on your tummy, he might actually feel the uterus getting tight, strong. And that's when the doctor will know that this is not ligament pain. This is not back pain that is not associated with labor. If the uterus starts to get tight and relaxed, then it is no longer the ordinary pain that you can use paracetamol and it will take care of it.
Okay. Yes. So you also, when you're talking about some of the causes, what could lead to preterm labor, you talked about diabetes and I think hypertension and some other stuff. What about fibroid? You didn't mention fibroid. I know there are other stuff as well, but
yes,
I know fibroid.
Yes, fibroid can, yes, it's the fibroid. You see, the fibroid, if it's just like 1 or 2 and is outside the uterus, it may not affect the uterus, it may not cause any problem. It may only cause, if it's degenerating, it can cause pain. But when a woman have big fibroid in the muzzle of the uterus or inside the yes, in the muzzle of the uterus. It can also cause the woman to begin to have a premature contraction. But the fibroid will be big or plenty. You know, some have, they may not be big, but they will be plenty all over the muscles of the uterus. This will affect the expansion of the uterus and can cause the woman to begin to have contraction prematurely.
Okay. Thank you, ma'am.
You're welcome. Any more questions? You can ask questions that is outside the topic. You are in your first trimester, second trimester, third trimester. You can ask questions about labor.
Good morning, ma.
Good morning.
Yeah, my name is Sandra, ma.
Yes, Sandra.
I gave birth to my first child in mother and child. So this is the second one, and that I want to give birth to. I'm currently 38 weeks plus, and sometimes I feel the signs of, the pains. My back pain just started today, but I was contracting 2 days ago. But
you feel your uterus tightening?
I feel my uterus tightening too.
Okay.
And as if some things move around my head whenever it happens. So I don't know whether to come to the hospital today or still hold on. Sometimes if I even come down from the bed, as if I'm walking on my baby's head or something. So I don't just know.
Yeah, since you are 38 weeks, I think you should go to the hospital. You see, when you get to the hospital, they will check whether you are, because sometimes you might be, some mothers, pregnant women rather, might be contracting and they will not know, and they will be dilating.
Yes.
So it's when you get to the hospital and the doctor will do what is called vagina examination. And it will check the cervix. If he sees that the cervix is opening, it will tell you to get your things and come to the hospital, or tell somebody to go and bring your things for you. Many women have been caught like that. They will just complain like you are complaining, and then the doctor will check them and will see that they are already in labor and they may not know.
Wow, okay.
Yes,
okay.
Yes. So you are 38 weeks. I think you should just see the doctor in the hospital so that they can check.
I wanted to come today, but I called and they said the gynae is not on seat.
No, you don't need a gynae to do that for you. There are other doctors in the hospital. Even a midwife can do that for you. And then you're good to go. You don't need a gynae doctor to do that.
Okay, ma. Okay.
Yeah.
Thank you very much, ma.
You're welcome.
Yes, ma.
Let's keep our question coming. Hello, let's keep our questions coming. I've told you you can ask questions outside the topic we had. Yeah, last fortnightly ago we did, the topic was on family planning and your 6 weeks. If you're in your third trimester, second trimester, fourth trimester, ask your questions.
Okay, hello.
Hello.
I have another question.
Hello.
Hello.
Yes.
Yes, so I have another question. Okay, so for me now, this is my own first time. I'm in my second trimester now, and I just registered for the antenatal clinic at Mother and Child. But the day I went, unfortunately, it was a Thursday, so I was told that's the surgeon's day or something, so you can't meet a gynae, right? But I did every other thing. So I just wanted to know what are my expectations? Because the next one I'll go for, I'm told, is a month. I should go back in a month because that day I did my anti-tetanus vaccination. They gave me blood, what's the name now? Capsule and the like, ahead. So they said I should start taking that one every day. Okay, so but I wanted to just know, because I haven't gone back, what am I supposed to expect when I go for the next one? I'm told I have to go back in a month.
Yes. All things being equal, you are not expected to feel anything other than to your baby's kicks. Hello? 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 Can you hear me? Can you hear me?
Go on, Matron, we can hear you. I can hear you, Dr. Ikele.
I said, till your next meeting, other than your baby's kicks, you should not have any issue. You should not have pains. You should not have problems with eating. You should not have problems with walking. And if there is any issue, put them all together. So when you see your doctor, you can discuss those things with your doctor. Hello?
Okay, good morning, ma.
Yes,
my name is Bisola.
Yeah, Bisola.
I just have this question. I missed my last anti-tetanus injection. I've had 2 kids, so I've taken all four tetanus. I learned it's supposed to be 5. I thought it was 4. So I missed the last one. Do I need to start all over again?
No, you don't have to start all over again.
Okay. Then secondly, I want to ask about COVID vaccine. Is this safe to take during pregnancy? I'm still in my first trimester.
Please you just discuss with your doctor, but I don't think you should take it during pregnancy.
Okay, ma'am. All right. Yes. Thank you very much.
You're welcome. Mothers, the floor is open for you to ask your questions. Mothers, let's ask our questions.
Okay, hello, ma'am.
Yes.
Let me ask one more question, please. I wanted to know, for breastfeeding, during my first delivery, the hospital had to get NAN for me to give to the baby because I was not secreting breast milk.
Lactating immediately.
Lactating, yes. So I don't know, what kind of meals should I take to help me with lactation in this next one?
This is your second, right?
Yeah, this is the second one.
Just make sure that you take enough fluid.
Fluid, okay.
Yes, take enough fluid. If in form of pap, juice, you can lace your water with lemon, anything that will encourage you to take enough fluid will help. Yes. Okay. And then clean your breast so that they are not blocked. The pores are not blocked.
Okay. Okay, ma. Thank you very much.
Okay. Welcome. Still waiting for questions. I've told you can ask questions outside this topic.
Good morning, ma'am.
Yes, good morning.
Thank you for the session, ma'am. So I would like to ask a question outside the current topic. When is the appropriate time to do a blood work or checkup on a child's maybe genotype, blood group, and the likes? What age?
Okay, for blood group, it can be done anytime, but genotype much later, when the child is older, like 1 year, but not before then.
Okay, ma'am.
Yes. For blood group, can be done as soon as the baby is born, because sometimes the child might need to be transfused. But for genotype, it cannot be done immediately. It could be done much later.
Thank you, ma'am.
You're welcome. Expecting more questions. We still have like 9 minutes more.
Hello, ma. This is Adenike again. I'm sorry.
You are welcome.
Earlier, yes, and my system just on my phone threw me out of the call. So when you were responding on the, what I should expect at antenatal, I couldn't hear. By the time I logged back in, you had answered the question.
Oh.
If you don't mind, I was thrown out. Can you just tell me what it is I'm supposed to expect when
before
I go
your next clinic?
Yes, when I'm going for the next antenatal session at Modern Child.
Yes, I said, aside your child's kicks, you should feel your child moving, you should play with your child in your thumb. Yes, aside that, you are not expected to have anything, have any other experience. There should be no pain, there should be no contraction, there should be no, anything that negates well-being of your baby and yourself. If there is anything you experience, then your next clinic, you should tell your doctor. If it's serious, then you can see your doctor before the next clinic.
Okay.
Yeah.
Thank you.
You're welcome.
Hello, ma.
Yes.
So I noticed that during my first delivery, I was at a spot lying down on my left side throughout, and the midwife was, advising me on what to do. But when I watch on other videos, I see that when a woman is in labor, she's allowed to, do some other kind of movements, maybe sit on a ball or kneel down, facing and placing her head down, like, different things that can assist with labor. Yes, because when I was lying down there, I was so exhausted. I felt like I should turn to other position, but she says I should remain on that spot. So I don't know if that's going to be the kind of experience I will have this time.
Did you have your last baby in Mother and Child?
Yes, my first baby. Yes.
Your baby you had a baby. You can lie on any side, but yes, actually, except you maybe complain of tiredness, of weakness, and the reason why she will say you should lie on that side is because you don't lie. The weight of your uterus is not lying on your blood vessel, so that's why she's saying that. But you really could lie on either side. You really could, sit down. You can walk. You can, it just depends on you. You can sit down. You can lie down. You can any position that is convenient for you will be all right.
Okay.
Yes.
Okay, ma. Thank you very much.
You're welcome.
Thank you, ma. Okay.
So I look forward to seeing you.
Thank you, ma. Okay. Yes, I'm even coming today.
Please do. Good.
Yeah.
Let the doctor check you. Yes.
Okay, ma'am. Thank you
So,
very much.
mothers, if you have questions, you can ask. But in the absence of any other question, I want to wish all of you safe delivery and pray that you will carry your baby to term and it will be well with all of you. Thank you.
Amen. Thank you.
You're welcome. See you in another fortnight.
Okay. Bye-bye.
Bye-bye.